morning, everyone. It's so wonderful to have you all here today. It's lovely to see so many familiar faces and also to see so many new faces. So at Sage Bionetworks, we do lots and lots of different stuff. And what's so wonderful about what we do is that we get to give it away as quickly as possible. So I'm going to talk to you today about one of the ways that we're trying to give away our understanding of informed consent and hopefully share knowledge that will help others all come along with us on this path of goodness. Quickly, just some disclosures. I do have some equity from my time at the Cleveland Clinic. I volunteer for the Global Alliance for Genomics and Health, which is a wonderful global genomics group, and for the National Societies of Genetic Counselors, I am a licensed genetic counselor, and I will talk to you about whatever genetic question you have anytime you'd like to talk about that. And then I also work with a number of wonderful people, including Sarah Moore, who's written lots of beautiful papers with me, and I so appreciate her partnership. So as a person who thinks about informed consent all of the time, I think we need to always start from a place of recognizing that adults can do whatever they want to do. They can do whatever they want to do. This is the best part of being a grown-up. You can have ice cream for breakfast. You can drive any way you want to get to the store. You can do anything you'd like to in your free time, so long as you are not coerced into doing what you're doing, and so long as you understand what you're getting yourself into. And I think that those are two really, really critical things, is that we need to make sure that we're creating systems that are not coercing people into doing things, and that we're creating systems that are sufficiently transparent so that people know what it is that they're doing. Now, of course, this is for grown-ups. We have lots of protected, vulnerable classes. Children are one example of a protected, vulnerable class. They don't really understand what they're getting into. As my nephew Charlie was explaining to me yesterday, he thought that if he would jump out of the window, he might bounce. And I said, although we are a family of scientists, let's not experiment with that one, because I can tell you the answer already. And they are also children easily coerced, which as a parent, many of you may use that to your tremendous advantage frequently, but would not be ethical in an area of research, even in unregulated research. And so it's important to point out that whether people are regulated or unregulated as researchers, the ethical principles that drive your actions remain the same. So again, trying to avoid coercion and trying to be open and transparent so that people really know what they're getting into, this is just good moral practice for your activities, whether or not they're regulated. How do we make sure that people are not coerced? This is actually a problem that plagues the regulated research system endlessly. No one has been able to define how we prevent coercion or how we assess coercion. It comes down to the you'll know it when you see it description, right? So don't be sketchy. And you also need to be really, really careful with incentives. And when we talk about incentives, it's not just about the money. Lots of people think about money as a key incentive, and certainly you can get lots of people to do all kinds of crazy things for certain amounts of money. But there's many, many other ways in which we create coercive systems. One of my favorite coercive systems is the NCAA, the National Collegiate Athletic Association. You may know it, you might, I don't know, have attended the Ohio State University, for example, or Michigan, or some other college. There was this study done of student athletes, around 400 student athletes from 4 major universities, from many different sports programs, men, women, equally represented. And they looked at concussion and pressure to play after having been concussed. And all of the athletes that were surveyed knew they had been concussed 1 or more times during their sports career. And 1/4 of them said, although I knew I was concussed, I continued to play. And the question is why? We think, oh, well, it's the coach They said, actually, it was the pressure from my parents, that my parents were watching me, that made me go back into the game. Which gives us pause as we think about the NCAA system and the way that it's now being regulated or unregulated. It's very interesting to see all of the different pressures that can be applied within a given system. So it's important to remember coercion is not just about money. It can be about peer pressure, it can be about family pressure, or it can be straight up direct, back alley sort of peer pressure. How do we make sure people understand? So again, adults can do anything they want to so long as they're not coerced into it and so long as they understand what they're getting into it. Good design can really, really help people understand, and Woody and Vanessa are going to talk about how good design can help people understand things, getting people the right information at the right time and the right place to be able to make their decision about participating. But the words that we use are critical. Really, really important for us to remember that it is so essential to use words that people understand. 1 in 5 people in the United States does not read at the 5th grade reading level. 20% of Americans can't read at the 5th grade reading level. So an informed consent document that's long or complicated, an end-user license agreement that has yelly sections in all caps, these are not accessible documents to the vast majority of Americans. One of my favorite stories about using language that people understand is about poo. If you have not seen the Pampers Poo Face video, you should see it. It's fabulous. It's a beautiful montage of children experiencing their first bowel movements in Pampers diapers. It's just a really wonderful thing. It warms the heart. And so my friend Michael, his father is a gastroenterologist, and he, when he finished his career working at a fancy hospital, then started volunteering at a public clinic. And so Dr. Lerner went to the public clinic, and he came back from his first day at the public clinic, and he said, "You will never believe what's going on. It's like a crisis in the GI world at the public clinic." And Mike said, "Dad, why?" And he said, "No one there is going to the bathroom. Nobody's having any bowel movements." And Mike was like, "What do you mean nobody's having any bowel movements?" He said, "I asked every single one of my patients today if they had a bowel movement, and all of them said no." And Mike was like, "Dad, if you just asked them if they pooed, maybe the answer would be different." And his father said, "That's ridiculous. Everyone knows what a bowel movement is." And Mike was like, "Yeah, no, probably not everybody." And so Dr. Lerner went to the clinic the next day and used the word poo, and amazingly, 8 out of 8, 100% of his patients reported having gone to the bathroom, having pooed in the past 24 hours. So the words that we use are really, really important. And there are a lot of pressures for us to make ourselves sound smart or look good or listen to our lawyers. And all of these pressures must be resisted, because your ethical obligation is to be understood. And in order to fulfill your ethical obligation to be understood, you have to use words that people understand. You got to do it. So how do you do it? We made a free guide. It's available to you. It tells you all kinds of ways of approaching people and approaching dense content and how you can break it down for people so that they can actually understand and digest it. It talks about getting your developers together with your lawyers when you're developing your privacy policy, and then taking whatever they come up with and digesting it again so that it's more understandable. One of the most brilliant suggestions that I ever heard for making things readable was from a group at Yale who hired a children's book author to help them rewrite their consent for a pediatric study, and they turned it into a graphic novel. So they're not complicated suggestions, they're elegant in their simplicity, and they're essential to your ethical obligation to the people who are using your tools. So, in conclusion, don't be sketchy, use words that people understand.